Marley Drug.
Hello, welcome to Ask Marley Drug. My name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. So today we're going to talk about commonly asked questions I get for a medication called Gilenya, also known as Fingolimod. So, is Gilenya now available as a generic? Yes. The Gilenya brand of Fingolimod has reached the end of its patent exclusivity period. The generic Fingolimod is now available for a much lower price for the treatment of relapsing multiple sclerosis. Many pharmacies charge thousands of dollars for a 1-month supply of this medication. However, at Marley Drug, we offer this medication on our website to our patients for a much lower price compared to other pharmacies, because our price of generic Gilenya is based on our wholesale price, which is the price we pay for the medication. What is Gilenya and how does it work? Gilenya is a prescription medication that's part of a drug class of medications known as immunomodulators. The FDA approved this medication for use in adults and children as young as 10 years old for the treatment of relapsing forms of multiple sclerosis. Gilenya works by attaching to sphingosine 1-phosphate or S1P receptors on lymphocytes. Keep in mind that lymphocytes are cells that become active in your lymph nodes, which are glands throughout your body that are part of your immune system. Typically, lymphocytes work to defend or protect your body from infections that are brought on by viruses or bacteria. However, in multiple sclerosis, your myelin sheath, which is a protective sleeve or sheath that wraps around your nerve cells or neurons, including those in your brain or spinal cord, is attacked by lymphocytes. Many multiple sclerosis symptoms are brought on by this inflammation, which also causes swelling and damage. Gilenya is then used to stop lymphocytes from leaving your lymph nodes when it binds to S1P receptors, and as a result, your myelin sheath cannot be attacked by lymphocytes. This can therefore decrease the severity of multiple sclerosis symptoms and stop the illness from progressing or worsening. The recommended dose of Gilenya is 0.5 milligram capsule, which is taken once a day with or without food. However, 0.25 milligrams taken once a day is the appropriate dose for those who weigh no more than 40 kilograms or 88 pounds. Keep in mind that your first dose of Gilenya will be administered in a medical setting, such as a doctor's office, by a healthcare professional. And after taking this medication, you must remain at the clinic for at least 6 hours so that your blood pressure and heart rate can be monitored. What if I miss a dose? Gilenya should be taken at roughly the same time every day so you don't forget to take it. However, if you do forget to take a dose, call your doctor right away. It's important to note that you might need to take your dosage while being closely monitored by a doctor if you skip 1 or more doses. You may need to repeat the 6-hour monitoring again. What are the side effects of Gilenya? Well, like all medications, Gilenya has a few side effects. Some common side effects may include back pain, headache, abdominal pain, diarrhea, pain in your arms or legs, abnormal liver function tests, or flu-like symptoms including cough or stuffy nose. And if you're experiencing any of these side effects, be sure to talk with your healthcare provider to determine whether a dose adjustment or switching to a different medication would be beneficial for you. Does Gilenya interact with other medications? Short answer is yes, it can. Always talk with your healthcare provider and tell them about all medications, supplements, or vitamins you may be taking, as well as any other medical conditions you may have. It's important to know that Gilenya may cause serious heart problems. So if you also take medications for conditions such as asthma, heart disease, including amiodarone, high blood pressure, depression, or other mental health conditions, your risk may be increased. Some medications that may interact with Gilenya include medications that slow down your heartbeat, such as digoxin, or beta blockers such as atenolol, or calcium channel blockers such as diltiazem or verapamil, or medications that are used for irregular heartbeat, including amiodarone. What should I avoid while taking Gilenya? Well, unfortunately, Gilenya can increase your risk of skin cancer, so it's important to avoid direct sunlight or tanning beds. It's also recommended to wear protective clothing and use sunscreen, especially if you're outdoors. It's also not recommended to receive any live vaccines, including shingles or yellow fever vaccine, while using this medication and for 2 months after your last dose. The vaccine may not work as well during this time and may not fully protect you from the disease. And like all medications, you should speak to your pharmacist or your healthcare provider about any questions you have. There's lots of information on Gilenya and multiple sclerosis on our website. Check out our blogs in the links below. Bye for now!